Why does fifth disease sometimes cause aplastic crisis in children? Imagine a virus that targets the very cells responsible for making red blood cells in your body. That's what happens with fifth disease caused by parvovirus B19. This virus specifically attacks early red blood cell precursors in the bone marrow, called proerythroblasts. These are the cells that start the process of making new red blood cells. When parvovirus B19 attaches to receptors on these cells, it stops them from developing and producing red blood cells. This sudden halt can cause a temporary shortage of red blood cells, which are vital for carrying oxygen throughout the body. In most healthy children, this interruption isn't dangerous because their red blood cells live about 120 days, and their bone marrow can quickly bounce back after the infection clears. But in children with certain blood conditions, like sickle cell disease or hereditary spherocytosis, red blood cells are destroyed faster than normal. When the virus stops the production of new red blood cells in these children, it creates a critical imbalance. Their bodies can't replace the red blood cells lost, leading to a severe drop in red blood cell count, known as an aplastic crisis. This crisis is usually temporary because once the infection is gone, the bone marrow resumes its work. During this time, children might look pale, feel very tired, breathe faster, or have a rapid heartbeat because their blood can't carry enough oxygen. They might also experience symptoms like weakness or dizziness. Fifth disease often shows up with a distinctive, slapped cheek, rash, and mild flu-like symptoms. But in children with blood disorders, the infection can cause this serious complication. Most of the time, managing an aplastic crisis involves supportive care, like blood transfusions, to help restore red blood cell levels. The good news is that most children recover fully within a week or two after treatment starts. So, in essence, fifth disease causes aplastic crisis because the virus temporarily halts the production of red blood cells by destroying the immature cells in the bone marrow. This effect becomes especially dangerous in children whose red blood cells are already being destroyed rapidly due to underlying blood conditions. That's why prompt medical attention and supportive care are so important for these children. Always remember, if your child shows signs of severe anemia or unusual fatigue during an infection, consult a healthcare professional for proper diagnosis and treatment.